Hi, my name is Karen Deep. I'm a student here at University of Manitoba. Today we have demo day and I'm going to be doing TPN verification and administration, as well as trach dressing and safety checks with that. So I'm going to start off with doing TPN. As you enter the patient's room, you can do hand hygiene. I could take my MAR and introduce myself. Hi, my name is Karen Deep. Is it working? Hi, my name is Karen Deep. I'm a student nurse. I'm going to be doing TPN for you today, administering TPN, as well as doing a trach dressing change. As I come in, I'm going to make sure everything's okay, make sure the IV pump rate is good, make sure everything for the trach is also good, which you can verify after. I can verify the name. So we have Fred Fredrickson, MRN number is 0990127, 37 years old. I can ask him to speak ask for his name. Fred Fredrickson. Okay, good. So we are verified that we have the correct patient here. Now we can verify the TPN. So there's a requisition for the TPN. This is the requisition here. And this pretty much tells us everything that we need to have in our TPN in order for it to do whatever it needs to do for the patient. So we can first compare this to the MAR. We have the right patient, so Fred Fredrickson, MRN 0990127, 37 years old, under Dr. Ames. This is our requisition, this is our physician's order. We can compare that we have the correct amino acids, so 100 grams, 200 grams of dextrose, and lipids is 50 grams, and our overall is 2,000 mLs of the solution here. So these are compared. Now what we can do is compare our requisition to our actual thing. So this is all sort of part of our first check. So I can come here and compare this first. I can look at the patient. So we have Fred Fredrickson there. MRN is not stated here, but we are verified that the name is correct. We can look at the amino acids, so 100 grams. We have 100 grams there, 200 grams of dextrose, 200 grams of dextrose there, lipids 50 grams there, and our total is 2,000 mLs, which we have there. So this is verified. If we needed to verify this, we can also verify with the second nurse. And so that's verified. So we can go ahead and start the administration. So we can take our requisition with us to the bedside. The first thing you want to do, so you know this is correct, you want to make sure the tubing is all correct. What you want for the TPN is a tubing that has no ports. This one, however, does have a port here, but you'd want no ports just so there's no medication that be administered while the TPN is running. This is going to be administered through the CVAD devices that the patient has here. Initially, what we can do is put some gloves on and flush the CVAD to assess for patency. So we can do that real quick. The one that we would want to be going into is usually I'm going to be going into the clear one. You don't want to be going into the brown one because that's the one meant for blood. So what we can do is prep our syringe. We want to take the air out, so we're not putting any air in. There's the blood right there. And then we can alcohol swab the CVAD. So I'm going to choose the clear one right here. It's clamped as of this moment. We can alcohol swab it for 30 seconds, let it dry for 15, but for demo's sake, I'm gonna leave it and do it right now. Attach this. I can unclamp this portion. I would flush 1 ml, draw back for fluid. We see fluid coming back, or blood draw back, and then we would push pause the rest of the fluid into there. And we could close as we do that. So that's good to go. We know that's patent and intact. Now what we want to do is attach our thing. So before that, we gotta set our infusion. So we know that it's primary, and we're gonna have it at 83.3. I could just re-enter this, 83.3, and we know that from this it's full 2,000 mLs, which is here as well. So 2,000 mLs. So that's good. We have that. We can confirm the primary. And then we also want to change mode, go all the way up, and we want to label it, and we want to find where it says TPN, which is right there. So we could select that and label the TPN. What we want to do now before we do this is do our second check. So I can get the requisition and the MAR again, we can verify that we have the correct patient by doing the ID band. So Fred Fredrickson, MRN is correct as well, 099127. Good. We can verify that we... Okay, so the phone had stopped, but what I was doing was my second check. So I had compared it to the patient with Fred Fredrickson. I was just comparing this part right here. We know that we have 100 grams of the amino acids, 200 grams of the dextrose, and 50 grams of the lipids. And the correct patient, we know we have full 2000 mLs of the solution here. So this is my second check. Now what I could do is attach it to the CVAD port that I originally had already flush for patency. So I would get this guy, get my port here. You would clean for 30 and dry for 15. Making sure you're maintaining sterility there. And before I start this pump, I want to do my third check, and this is a third check that needs to be done with another RN. So I'd have another RN come in with me. We would verify that we have the correct patient. So we have Fred Fredrickson. The MRN is 099-0127, 099-0127 on both requisition and the MAR. We can ask the patient to state the name. He states the name, Fred Fredrickson, and that's good to go. The nurse and I can now compare this. We know that it's for Fred Fredrickson, the correct patient. We have the 100 grams of amino acids, 200 grams of dextrose, and 50 grams of lipids, as well as the other ones, so 120 of sodium, 60 of potassium, 10 calcium, magnesium 10, phosphate 15, and chloride 158. Altogether, that leads to the 2000 mLs, and that's our third check that is completed. So now we can start the pump. We have it set to the 83.3 mils, 2000 mLs to TPN, and we can press start to start administering this. So that's administering. We would wait for the 3 drops here. This would have to be fully open. And we have the 3 drops going. At this time, I could also tell you guys that the patient did have the right to refuse, but the patient did not refuse, and the patient, there are the 3 drops right there. And we also are going to go document this after and report that we're administering the medication or the TPN and it's been done correctly. Okay, so now we're going to go on to the trach part of it. So we could take our dressing tray here. For demo purposes, I'm going to be facing you guys. Otherwise, I wouldn't be facing the patient like this. I would be on the other side. But for demo purposes, I'm going to be doing like this. What you want to start off with is doing a general check of the safety equipment. So what you want to do is make sure all the equipment is connected. So we have our suction thing here. We know that this is the tubing for it. It's connected here. We can turn it on. Making sure it's clamped.
So I'll demonstrate that right away. So do you want to come to the side? I'm just going to show you the side. Alright, so as far as
So the suction should be working, and we can verify that it is. What we also want to do is make sure that we have a cold pot here with oxygen attached to it. It's supposed to be at 60%, which is in the doctor's order that we can have right here. So a cold pot at 60%. That is good. And we can verify that with the arrow. It's at 60% right there. We'd want the oxygen working, and so you can do that by this. We know the oxygen is working. So those aspects are good. We also have the ambu bag here. We have our equipment, safety equipment, just in case there's an emergency that arises. So in this we have our ambu bag tubing. We have our measuring cuff, which I'll need in a second. And then we also have extra trach tubing. We have our extra DIC. and just extra equipment just in case there's emergency that arises. So everything seems to be working, and we're going to start with our procedure. So we could do a patient check. We already know it's the correct patient, but I could just look over the band right here, look at our mark, compare the name. Fred Fredrickson, MRN is 0990127. That's good. You could state the name. We know this is the correct patient. So what we want to start off by is doing something called pre-oxygenation, which we oxygenate the patient right away. In our IPN, it did state that the patient is able to take breaths on their own, so we don't need to ambibag the patient. What we could do is increase the oxygen to 15 liters and get the patient to take two to three deep breaths, and that will hyperoxygenate the patient. We can also attach an O2 monitor throughout the procedure to monitor it, but we don't have an O2 monitor here, so for demo's sake, we're just going to say we do have the O2 monitor there. So I'm going to tell the patient, let's get into semi-Fowler's position here. There we go. I'll increase the height. I would say, hey, my name is Karen, I'm a student nurse. I'm going to be doing your trach dressing. I'm going to be oxygenating you right now, so I'm just going to increase the 15 liters for about 15 to 20 seconds. Just until they take 2 to 3 deep breaths. So I'm just going to increase this, 15 liters. Take 2 to 3 deep breaths. They do that. They are oxygenated now. And now what we want to do is do our suctioning. So we have our suctioning equipment here. It should be working. However, in this case, it doesn't seem to be working. So we have this. And then we want to put gloves on for this part. We could put double gloves just because that's how the procedure works. So the way that we want to do this suctioning is take off this part right here. Just as such. Take this guy off there. We can put that here, and we can look at our canula. We know that's dry and intact. I would also have a mask on for this. I have a mask here, but for demo purposes, I'm not going to put a mask on. But you don't want to get any of this contaminated. If you look there, it says 7. So the way we choose our catheter size is 7 minus 2, so 5 times 2, which is 10. So if you select this port right here, it's 10 French, which is the correct catheter size. What we can do at this part here is use sterile technique to attach the catheter. So we can open this guy up. Open this guy up in a butterfly form. Attach our tubing. And what we can do now is pull this out. You want to maintain at least 4 to 5 inches of sterility. So everything underneath this part right here would be not sterile. Everything above is sterile. You don't want to suction while you're going into the patient. And you want to start suctioning while it's inserted in the bifurcation, or when your fingers reach the end of the thing over there. So we can increase our suction. Your suction should be at 80 to 120, which is within the medium range. So what would happen is, if the suction was working, it would be low, but then the second you press here, put your finger and cover this up, the suction would go between 80 to 120, and we could say for this case that it is between 80 to 120. So now I would insert this into my patient, just as such. There we go. And as I come out, I can do something called intermittent suctioning, which I would click here and it would suction, and I can spin this like that, and we would do as such. We can grab this with this hand and discard of this catheter, and the suctioning is now done. What we could do with this is get our sterile water, which is right here, and suction that, as well as put a glove over top to show that we are done suctioning and to maintain cleanliness here. We could keep watching the O2 stat monitor to make sure it's good, and other than that, we're good at that portion. What we want to do now is check the cuff pressure. So what we want to do here is we want to take this guy. This should be between 20 to 30 centimeters of water. So what we want to do is first alcohol swab. I have alcohol swabs right there if you want to grab those. Thank you. Thank you. So we want to alcohol swab both this and this. This is already sterile because it's closed, so we want to alcohol swab this guy right here. This portion right here. And we can open this guy up and attach that right there. So we see that it's less than the 20 to 30, so we can increase it, or that was too much. So there we go, it's between the 20 to 30 mark there. So we can close this guy.
And our pump is beeping.
Should I get April?
I'm just gonna put on standby.
Okay. So cuff pressure is checked there. We can put this back in our bin. Okay, April.
We're just gonna get the teacher because the pump is beeping.
Okay, there's no teacher available, but
There's 20 minutes left, guys.
okay, we can just leave it. Let's just leave it. It's probably included or something. You know what? It's probably. We can leave it. Let's leave it.
I don't know. One sec. Yeah, okay, whatever.
Let's just leave it. Yo, let's just leave it.
Okay.
So we measured the cuff pressure, and now what we want to do is change the inner cannula. So this is I'm going to do it by clean technique. What we want to do in this case is take this one out and open this one up using sterile technique and only touch the rim portion. So what we could do is take this guy out like this, stabilizing here, pulling out as such, and this would be discarded.
Yep. Well, it's 7 minutes.
Okay, and then we would throw that in the garbage, which I have underneath me. I would grab this one as such, making sure to maintain sterility, stabilize this, and I would put it in as such there. So that's good. So that's the inner cannula that's changed. We're good to go. And now we can
Wanda.
Wanda or pump is just fine. Okay.
Sorry, thanks.
And then I would remove these gloves and put on new gloves for our dressing change. So I'm just gonna get everything set here. Thank you.
Alright, now I'm just assessing on the side here. I can assess the site as well as the
So I'm gonna open this up. I would put gloves on at this time, and I would take my old dressing out, assess the stoma that's there to see if there's any signs of irritation and if it's healthy. This would be garbage, which I have right there. So what I want to do with this portion is grab this, pass it over. I can set this up as a garbage portion. There we go, we can do that to the side. Push this to the side. Push this to the side. Like here, I don't want to put in my swabs, so we can open it up over top of this, pull it out like this. Put it there.
Got about 3 minutes.
Some of these. As well as this. So what I want to start off with is putting, if that touched the 2-inch border, I would get a new one and put it in. For this case, say I only have one, so I would reopen it as that and then put it in. I also want to put sterile normal saline in here. Good. And we can start the cleaning. So I would get my swabs, do that, make sure it's dry, do one swipe underneath, discard. Another one, dry it, swab, discard. And then I could make rosettes with this. Swab over top, discard. Do the same here. Swab underneath, discard. And now I can dry it. So I can dry it with my. And I would just dry this regularly, swab, done. And then I would do the same here. And then swab underneath, and that's dry. And now I would get my dressing. And I would place it there. You want to make sure the stoma part that's touching the stoma is sterile. You can push this up as such, as well as over here. And at this point, you can use your hands, making sure you're not touching the inner portion of the stoma. Pull this up as such, making sure to keep the inner stoma sterile. I would put the oxygen back on at this point, make sure my patient is okay, clean up my mess, and assess everything, do a safety check, document, and I'm good to go.